Professor David Wood, Professor of Cardiovascular Medicine at the International Centre for Circulatory Health, Imperial College London. Welcome to Cardiolics TV, Doctor.
Thank you.
Is it the first time for you in Egypt?
No, I have been to Egypt many times. It is one of my favorite countries. I have come here with my family. I enjoy being here very much.
And how are you staying? How do you like your stay here?
Well, Alexandria is a very special city, and every time I come here to Cardiolics and to the city, I always visit the bibliothèque because it is such a special library, and being an academic, I like books.
And what about your talk here at Cardiolics? What would you like to highlight about the talk that you're going to give?
So my special interest is prevention of cardiovascular disease. And there is now a new international agenda. The United Nations heads of states made a political declaration in New York in September 2011 to reduce the burden of non-communicable diseases, and that's mainly cardiovascular disease worldwide. And the goal they have set is to reduce premature mortality from non-communicable diseases, principally cardiovascular, by 25% by 2025. So it's a very ambitious goal, and we are working towards achieving that goal.
So it's an international campaign and a campaign of awareness for people.
In fact, it's an international alliance, a global alliance which brings together all of those professional organizations and groups that have a special interest in cardiovascular prevention, including colleagues from the Egyptian Society of Cardiology. And the object is to work together to achieve excellence in guidelines and standards, education and training, delivery of preventive cardiology care, research, and to build new leadership in this area of prevention and rehabilitation.
Professor Wood, how do you find Cardiolics regarding the scientific program, regarding the organization? How do you find Cardiolics as a cardiology conference?
Well, Cardiolics is an excellent meeting, a very good scientific program, very dynamic, as you can see and hear, and it's always a pleasure to contribute to this meeting.
Do you think it's pacing with other international cardiology conferences, like bringing up the new techniques, new technologies here to Egypt?
Yes, I am sure it is, and actually these meetings are extremely important. It's important for cardiologists to meet face-to-face and to meet the providers of new technologies and pharmaceuticals, and to learn what is the latest in terms of scientific evidence and how that evidence can be translated into the care of our patients. So this is a very worthwhile meeting.
Did you find any progress between Cardiolics last year and Cardiolics this year, or amongst all years?
No.
Okay. And what about the educational materials? Do you think are they well established? Are they of interest to junior staff?
I think education and training is extremely important, and such education and training programs should be led by the Egyptian Society of Cardiology. They should set the standards, and these programs should be available at meetings like Cardiolics.
Do you have any recommendations for the upcoming years for Cardiolics?
I think greater emphasis should be put on prevention of heart attacks and strokes, and Cardiolics should become a vehicle for this new initiative to try and reduce the burden of cardiovascular disease in our population.
Professor Wood, thank you very much for your participation, and I hope to see you next year in Cardiolics. Thank you. I hope you enjoy Cardiolics.